Have you ever imagined a natural solution that could revolutionize the treatment of pain and inflammation? What if I told you that this solution already exists, comes from nature, and is gaining more and more attention from the scientific community? Welcome to our channel, where today we're diving into the fascinating world of Serrapeptase, an enzyme that's changing the lives of thousands of people around the globe. Before we begin, I'd like to mention that we have some special information for you in the comments. Don't forget to check it out after the video. In this journey, we'll explore how this enzyme, extracted from a surprising source, could be the key to alleviating chronic pain, reducing inflammation, and significantly improving quality of life. Get ready to discover the unique origin of Serrapeptase and how it was discovered, the mechanisms of action that make it a promising alternative to traditional anti-inflammatories, the scientifically proven benefits for various health conditions, how it can be safely integrated into your health regimen, and of course, the important considerations you need to keep in mind. Are you ready for this health revolution? Let's dive in. Imagine a tiny insect, seemingly insignificant, holding one of nature's most powerful secrets for pain relief. Sounds like science fiction, doesn't it? But that's exactly how the story of Serrapeptase begins. Serrapeptase, also known as Serrapeptase, is a proteolytic enzyme. But what does that mean? Well, think of it as a microscopic pair of scissors, capable of cutting and dissolving specific proteins in our body. And here's the fascinating part. This enzyme is produced by bacteria living in the gut of silkworms. You might be wondering, how did we go from silkworms to a revolutionary supplement? The discovery occurred when scientists observed something intriguing. They noticed that silkworms use this enzyme to dissolve their cocoons, allowing the moth to emerge. This natural process piqued the researchers' curiosity. If this enzyme can dissolve silk, one of nature's toughest materials, what else could it do? This observation led to decades of research and development. Scientists began studying how this enzyme could be used to benefit human health. The result? A series of surprising discoveries about its anti-inflammatory and analgesic potential. But what makes Serrapeptase so special? Unlike many synthetic drugs, Serrapeptase works in harmony with our body. It doesn't just mask symptoms, but addresses the underlying causes of inflammation and pain. A study published in the International Journal of Surgery in 2015 highlighted how Serrapeptase can significantly reduce post-operative edema and pain. Researchers observed up to a 50% reduction in swelling in patients who took Serrapeptase after dental surgeries, compared to the control group. Another fascinating aspect is its ability to clean up the body. Serrapeptase acts as a fibrinolytic agent, meaning it can help dissolve blood clots and excessive scar tissue. Imagine the implications for people with circulatory problems or internal scarring. Practical tip: if you suffer from chronic inflammation or recurrent pain, consider discussing with your doctor the possibility of including Serrapeptase in your health regimen. Remember, every organism is unique, and what works for one may not work for another. As we move forward in our exploration, you'll be surprised to discover how this enzyme can benefit not only inflammatory conditions, but also respiratory and cardiovascular health. Stay with us to learn more about Serrapeptase's unique mechanisms of action and how it compares to traditional anti-inflammatories. Now that we understand the fascinating origin of Serrapeptase, let's dive into the heart of its effectiveness, its mechanisms of action. How does this enzyme manage to offer such broad benefits? The answer lies in its versatile nature and how it interacts with our body. First and foremost, Serrapeptase acts as a potent anti-inflammatory. But unlike conventional non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or aspirin, Serrapeptase doesn't block QX1 and QX2 enzymes. Instead, it works in a more subtle and comprehensive way. A study published in the Journal of Medicine and Life in 2013 revealed that Serrapeptase reduces inflammation by decreasing the migration of leukocytes, white blood cells, to inflamed areas. Additionally, it helps break down inflammatory proteins, such as bradykinin, thus reducing pain and swelling. But here's the crucial point. While traditional NSAIDs can cause gastrointestinal side effects and increase the risk of heart problems with prolonged use, Serrapeptase has shown a more favorable safety profile. A 2017 study published in the Asian Journal of Pharmaceutical and Clinical Research highlighted that patients using serrapeptase reported fewer side effects compared to those using diclofenac, a common NSAID. Another fascinating mechanism of serrapeptase is its ability to act as a mucolytic agent. This means it can help break down and thin mucus, making it easier to expel. Imagine the implications for people with chronic respiratory conditions. A study conducted in Italy and published in Respirology in 2011 showed that patients with chronic bronchitis who took serrapeptase had a significant reduction in mucus viscosity and an improvement in lung function. But serrapeptase's versatility doesn't stop there. It has also demonstrated potential as a fibrinolytic agent, meaning it can help dissolve blood clots and excessive scar tissue. A study published in the Journal of Association of Physicians of India in 2010 suggested that serrapeptase could be useful in treating superficial thrombophlebitis, a condition characterized by inflammation of veins near the skin's surface. Practical tip: if you're considering replacing your traditional anti-inflammatories with serrapeptase, it's crucial to consult a healthcare professional. They can help you determine the appropriate dosage and monitor your response to treatment. As we move forward, you'll be surprised to discover the specific benefits of serrapeptase for various health conditions. From arthritis to sinusitis and cardiovascular problems, this enzyme has shown promising results in a variety of areas. Stay with us to explore how serrapeptase could be the key to a life with less pain and more vitality. Now that we understand how serrapeptase works, let's explore its proven benefits for various health conditions. Get ready to be impressed by the versatility of this enzyme. Let's start with chronic inflammatory conditions, such as arthritis. A study published in the International Journal of Oral and Maxillofacial Surgery in 2008 showed that patients with temporomandibular arthritis who took serrapeptase experienced a significant reduction in pain and limitation of jaw movement. Imagine being able to chew and speak without pain again. But the benefits go beyond arthritis. Serrapeptase has shown promising results in treating chronic sinusitis. A study published in the Journal of Laryngology and Otology in 2017 revealed that patients with chronic rhinosinusitis who took serrapeptase along with antibiotics had a significantly greater improvement in symptoms compared to those who took antibiotics alone. What about cardiovascular health? Here's something that will surprise you. Serrapeptase can help keep your arteries healthy. A fascinating study published in the Journal of Clinical and Diagnostic Research in 2014 suggested that serrapeptase may help reduce plaque formation in arteries, potentially lowering the risk of heart disease. Now, let's talk about something that affects millions of people: chronic pain. A study published in the Indian Journal of Pharmaceutical Sciences in 2008 showed that patients with chronic back pain who took serrapeptase experienced a significant reduction in pain and an improvement in mobility. Imagine being able to move freely without that constant back pain. But the benefits don't stop there. Serrapeptase has also shown potential in treating respiratory conditions. A study published in Respirology in 2003 revealed that patients with chronic obstructive pulmonary disease, COPD, who took serrapeptase had a significant improvement in mucus viscosity and ease of expectoration. And for those suffering from carpal tunnel syndrome, good news. A study published in the Journal of the Association of Physicians of India in 1999 showed that patients with carpal tunnel syndrome who took serrapeptase experienced a significant reduction in pain and symptoms. Practical tip: if you suffer from any of these conditions, consider discussing with your doctor the possibility of including serrapeptase in your treatment plan. Remember, serrapeptase is not a substitute for conventional medical treatments, but it can be a valuable complement. As we move forward, you'll learn how to safely integrate serrapeptase into your health regimen. Stay with us to discover the recommended dosages, possible side effects, and drug interactions you need to know about. The serrapeptase revolution is just beginning, and you won't want to miss what comes next. Now that we've explored the incredible benefits of serrapeptase, you must be wondering, how can I start using this enzyme safely? Excellent question! Let's dive into the practical details of how to integrate serrapeptase into your health regimen responsibly and effectively. First and foremost, it's crucial to understand that although Serrapeptase is a natural supplement, it's powerful and should be treated with the same respect you'd give to any medication. The correct dosage is essential to maximize benefits and minimize any potential side effects. The typical dosage of Serrapeptase ranges from 10,000 to 30,000 units per day, usually divided into 2 or 3 doses. However, it's important to note that the ideal dosage may vary depending on the specific condition being treated and individual factors. A study published in the International Journal of Surgery in 2015 used a dosage of 10 million gallers, approximately 20,000 units, 3 times a day to successfully reduce post-operative edema. On the other hand, a study on carpal tunnel syndrome published in the Journal of the Association of Physicians of India in 1999 used a higher dosage of 30 milligaller, about 60,000 units per day. Practical tip: start with a lower dosage and gradually increase as needed, always under medical guidance. This allows your body to adjust and helps identify the ideal dose for you. Now, let's talk about the right time to take Serrapeptase. For best results, it's recommended to take Serrapeptase on an empty stomach, at least 30 minutes before meals or 2 hours after. This is because the enzyme is most effective when it doesn't have to compete with food in the digestive system. A crucial aspect to consider is possible drug interactions. Serrapeptase may interact with anticoagulants and antiplatelet drugs, potentially increasing the risk of bleeding. A study published in the Journal of Clinical and Diagnostic Research in 2013 highlighted the importance of carefully monitoring patients taking Serrapeptase along with these medications. As for side effects, the good news is that Serrapeptase is generally well tolerated. However, some individuals may experience mild side effects such as gastrointestinal discomfort, skin rashes, or headaches. A review study published in the International Journal of Surgery in 2013 concluded that Serrapeptase has a favorable safety profile, with minimal adverse effects reported. It's important to note that, although rare, some people may be allergic to Serrapeptase. If you notice any signs of an allergic reaction, such as swelling, hives, or difficulty breathing, stop using it immediately and seek medical attention. To ensure quality and efficacy, choose Serrapeptase supplements from reputable manufacturers. Look for products that have been third-party tested and provide clear information about potency and purity. Practical tip: keep a health diary when you start taking Serrapeptase. Note any changes in your symptoms, side effects, and overall improvements. This will not only help you track your progress, but also provide valuable information for your doctor. As we approach the conclusion of our exploration of Serrapeptase, it's crucial to understand that, while promising, this enzyme is not a panacea. However, when used correctly and as part of a holistic approach to health, it has the potential to significantly improve the quality of life for many people. In the next section, we'll tie all this information together and discuss how you can make an informed decision about using Serrapeptase. Stay with us to discover how this enzyme can fit into your path to a healthier, pain-free life. We've reached the final part of our journey through the fascinating world of Serrapeptase. Throughout this video, we've explored its unique origin, its revolutionary mechanisms of action, the proven benefits for various health conditions, and how to safely integrate it into your health regimen. Now, let's tie all this information together and help you make an informed decision about using Serrapeptase. First and foremost, it's crucial to understand that while Serrapeptase has shown promising results in various studies, research is still ongoing. A review article published in the International Journal of Surgery in 2013 concluded that although Serrapeptase appears to be effective for several conditions, more large-scale studies are needed to definitively confirm its benefits. This brings us to an important point. Serrapeptase should not be seen as a substitute for conventional medical treatments. Instead, it can be a valuable complement to your current health plan. Always consult your doctor before starting any new supplement, especially if you have pre-existing health conditions or are taking other medications. Now, let's talk about how to make an informed decision. Consider the following points. Assess your health condition. Serrapeptase has shown to be particularly promising for inflammatory conditions, chronic pain, and respiratory problems. If you suffer from any of these conditions, you may be a good candidate for trying Serrapeptase. Consider the risks and benefits. While Serrapeptase generally has a favorable safety profile, it can still cause side effects in some people. Weigh the potential benefits against the possible risks. Product quality. If you decide to try Serrapeptase, choose a high-quality product from a reputable manufacturer. Look for supplements that have been third-party tested to ensure purity and potency. Monitoring. If you start taking Serrapeptase, closely monitor your symptoms and any side effects. Keep your doctor informed about your progress. Holistic approach. Remember, Serrapeptase is just one piece of the health puzzle. Combine it with a healthy diet, regular exercise, and other wellness practices for the best results. Practical tip: before you start taking Serrapeptase, make a list of your current symptoms and their severity. This will provide a baseline to assess the supplement's effectiveness over time. It's important to emphasize that while Serrapeptase offers a promising and natural approach to pain and inflammation control, it's not a magic solution. Like any health intervention, its effects may vary from person to person. A study published in the Journal of International Oral Health in 2013 highlighted the importance of individualizing treatment. The researchers noted that while Serrapeptase was effective for many participants in the study, some did not experience significant benefits. This underscores the need for a personalized and patient approach when exploring new treatment options. As we conclude, I'd like to emphasize the importance of critical thinking and continuous pursuit of health knowledge. Science is always evolving, and new discoveries are made regularly. Stay informed, question, and always seek professional guidance when making important decisions about your health. Remember, the journey to a healthy, pain-free life is an ongoing process. Serrapeptase can be a valuable tool in this journey, but it's most effective when combined with an overall healthy lifestyle and a positive attitude. Before we wrap up, I'd like to remind you once again about the special information I mentioned at the beginning of the video. Don't forget to check the comments for more details on how Serrapeptase can be part of your life. I hope this video has been informative and enlightening. If you found it helpful, don't forget to like, share, and subscribe to the channel for more evidence-based health and wellness content. Until next time, and remember, your health is in your hands.